Right, okay, so you've done the x-ray.
So this is a doggy with a tooth root abscess, and you can see with the cursor that all of this bone is missing around this tooth. And this one's a bit difficult to see. I need to take another shot to get a deeper shot of that. But this is what it would look like normally. You can see there's bone around there, but you can see all of this bone has disappeared. So this tooth needs to come out, and this tooth, I've examined it, you can see, you can just very lightly see here, there's a big patch of bone that's missing here. If we have a look at this x-ray, you can see all of this bone is missing here, and this is all just formed a nice big abscess. So we're going to go ahead and take both of these teeth out. I'm going to leave the canine that's there. This little one is basically resorbing, so I'm not going to bother about that. I can just basically chop it off at the crown. So you can have a look at this big lump that he's got here.
Poor thing. And this was referred from another clinic, right? Because we were, because we are, we're set up.
A big tooth root abscess. We're going to sort him out.
Wonderful.
It's going to feel much better after this.
Wonderful.
Little pricks. Or my instrument, just round the back here.
On a scale of 1 to 10, how much pain would this dog be in?
Oh, it's quite sore, yeah. It is quite sore. I'm just going to loosen that ligament here. And we're just attached on this side here. Just be very careful that I don't slip. Okay. I mean, that tooth is well rotten. I can just pull it out. Here we go.
Wow.
Nice and loose.
Wow.
There's a big hole in there, and there probably will be some pus that leaks out of there.
That must be such a relief.
Yeah, I'm going to just stick a small instrument in there, and hopefully we can just release some of that. You just have to be very careful with this area because this is right underneath the eye. I'm just going to open up.
So ultimately that infection will run straight into the...
Oh yeah, no, that's why we've got the swelling right underneath the eye. So I'm just making the hole a little bit bigger, and then that will just automatically make a draining tract into that area. There we go. His friend in front of it is also not looking great, this tooth. But
so you might as well come out? Or?
This one I'm going to try and take out as well, yeah.
Makes sense, right?
Yep. Look how red and sore that is.
Wow.
Thing.
That is mental.
I'm just going to pop some of this in here. Let's see if we can. That one is also really loose, that one at the back there.
How old is this dog?
3.
Only 3 years old?
Yeah, it's a Chihuahua. It's pretty normal for Chihuahuas to have.
Every breed has something, right?
Yep. And they normally have not got great teeth, unfortunately. Okay. Yeah, that's going to come out as well. It's very loose. Okay, so this is his little friend that's behind that I'm just trying to get out. I'm just using the elevator to cut some of the gingival tissue there. I might actually use a little pair of scissors just to trim that back there and get him out, but it's very loose.
Wow.
Let me just get a tiny.
So you're just monitoring the pulse?
Yeah, just doing a femoral pulse here just to see it matches up with your main cardiac pulse.
Which is very important with little dogs, right?
Yeah.
So I am just going to try and get hold of this.
Very delicate.
Very delicate. I'm using a very pointy blade, and I'm just going to cut. A little piece of tissue that is holding the tooth in there.
That's out now.
There we go.
Beautiful.
That is out. No teeth, no problem.
208. And we're marking it off now, right?
I'm just taking this little friend out. I might have to drill this out. Sometimes you can actually just use an elevator. It's just the one root. So what I'm doing is I'm just loosening that periodontal ligament. In a bigger dog you have to make a big flap, but with such a small doggy I am trying to get away with not.
And I've just noticed that the great vet doctors, they have such decorum. They're delicate with this and patient.
You have to be with the dental.
Because when you're not, that's when things get snapped, and
Exactly.
we don't want that.
No, we don't want that.
Wonderful.
You know, if things don't resolve, then you can try something else. But generally, that's all.
That should
really
work,
needs.
especially getting rid of the root cause, should we say?
Yeah, exactly. Excuse the pun. It is the root cause.
You're doing a great job, Doctor.
Difficult to get in there. Up a bit. Should be able to pull him out. Twisty action.
That was just some patience.
Just a bit of patience.
There
And
we
we've
go.
got the whole root tip as well.
That is why you are indeed an angel. How wonderful is that?
There we go. So I'm just going to put a stitch in there and close
Our
it up.
client is the dog. Look at this dog's face, huh? Beautiful. Well done, Doctor.
No problem.
Absolutely brilliant. Bravo. You were referred to us today, and your dog had an abscess. How's the experience been so far?
Brilliant.
Amazing.
Yeah.
Starts with
Very
lovely,
grateful.
pleasant,
Excellent.
and
Excellent.
I've looked after him great.
Excellent. We're here tomorrow. Any concerns at all, you give us a call.
Yeah.
We're very focused on our customer services. Our client is a dog. I watched this operation myself, and I'm very relieved for this dog. So the very best of luck to all of you, okay?
Thank you.
All right. Please feel free to call the Noahs Ark team for any type of support that you might need. We have a state-of-the-art facility set in 55 acres. We also have paddocks that clients can use for running their dogs. And due to our sort of historic ability to handle the more powerful working dogs, we specialize in that aspect.